Patients with irritable bowel syndrome or bloating or vague abdominal pains often have intolerances to certain foods, certain sugars. And at Concorde, we're able to test for those sugars or intolerances. For example, some patients have lactose intolerance or fructose intolerance, and that means that they can't digest those sugars. So when they eat those sugars, those large molecules, and if they don't get digested, those sugars end up going down through the GI tract and reach the colon where the bacteria live, and the normal bacteria eat those sugars that we don't digest. And if that occurs, the bacteria produces gas, and patients can have bloating and can even get diarrhea. This is an example of a breath test that we do. We can give the patient some lactose, which they ingest, and then we measure their breath every 15 or 20 minutes. Normally, the patient should digest the lactose and it should go into the bloodstream, and none of it should reach the bacteria in the colon. But if a patient has lactose intolerance, they won't be able to digest it, and the lactose will therefore reach the colon, reach the bacteria, and the patient's going to start to produce a lot of gas because the bacteria is eating the lactose. This is what it looks like. The patient drinks it, and we measure their breath. If their bacteria are producing gas, we can measure it in their breath using this machine outside. And if their levels of hydrogen or methane go up, that means they could not digest it and the bacteria ended up eating it. And therefore the patient would have something called lactose intolerance. We can do the same thing for fructose, and we can also use breath tests to diagnose small intestinal bacterial overgrowth, or something called SIBO, which is often associated with irritable bowel syndrome.